unpredictable and debilitating and life-changing. It started really after I had my son when I was 32. I sort of went downhill very quick, but apparently I had had symptoms. I'd always suffered from ulcers. I mean, I'm talking 30 ulcers at any one time. And then after I had my son, all my joints started swelling and I was getting headaches. I couldn't walk, basically. I was in a lot of pain, and it just sort of came on overnight. It was a few months to get a diagnosis, but when they'd looked back in my files, they had written it in my file at the Countess 10 years previously, but never mentioned it to me. So there was signs of it then. It affects you every part of your life, from your sleeping, because you're in so much pain and you can't move. My husband has to help me out of bed. He helps me get dressed. He showers me. It can affect any part of your body. It could be your organs, it could be your brain, it could be your eyes, it could be your skin. So you just don't know. It's very unpredictable, really. So I try and make the most. If I have a good day where I can get up and I'm not in too much pain, I try to do what I can, because you don't know when you're going to be struck next, when you're not going to be able to do things. Well, when I just got diagnosed by Professor Moots in Liverpool, he kindly said, he gave me some leaflets to give to my GP and said, if he doesn't know how to treat you, ask him to give me a call. And when I went to my GP and told him this, he said I wasn't worth it. He said that he had 6,000 patients in his practice and only one who had Bechet, so it wasn't worth his time. The main symptoms of Bechet's is oral ulcers, genital ulcers, and arthritis and swollen joints and fatigue, headaches, and maybe sight problems. It presents itself and it can look like herpes, and most people get diagnosed with herpes and it's not, and then that can make them feel really bad about themselves. When I had genital ulcers, my GP, I asked him, because I couldn't go to the toilet because it was so painful, I asked him for some cream to put on, if I could have some cream, and he just asked me how many boyfriends I had. And that made me feel absolutely awful, and I felt so dirty. But it wasn't that, obviously, but a lot of people do get diagnosed, and it might prevent them from seeking help, and it's not that at all. Some things actually have made it worse when I've tried them. That's the thing with one drug, it doesn't always work for everyone. It's sort of like a pathway where they try you on kind of drugs first, shall we say, like immune suppressants, as if people have had an organ transplant. They worked for a few years, but I've progressed on to biologics, which they call the designer drugs. But they are very expensive and funding can be difficult, especially in Wales. Managing the fatigue is difficult. You have to pace yourself. So if you do have an appointment, you don't make any appointments for the day before or the day after because you're so worn out. That's difficult. And you can't plan either, because you don't know how you're going to be on that day. And the thing is, because we look okay on the outside, everyone always thinks we're okay on the inside, but you can't see our pain that we're suffering with. I travelled around the world. I'd worked in Sydney Olympics. I was a skier. I'd done ski seasons. I'd worked in Ibiza. I was a career person, and I lost my career and I lost all my hobbies as well, because you can't do them when you become so ill. And grieving for the life that you had has been hard, and trying to make a new life with what you've been left with, really. I would recommend to read up on their condition so you understand what they're going through, because a lot of people put a brave face on. I know I often, when people say to you, how are you doing? And you say, oh, I'm okay, because you don't want to burden them with all your worries and how you're feeling. So you just try and put a brave face on. So if they read up on the condition and understand what the person's going through, then they can see it through their eyes, and just be understanding and try and be patient with them. Awareness is important because most people haven't heard of Bechet's. It's so rare. Even medical professionals haven't heard of it, so it's really difficult to get treated. So to bring awareness to this condition would be fantastic.